Thank you for joining our Debbie's Dream Foundation webinar series. Today's webinar is on coronavirus, what the stomach cancer patient needs to know, with Dr. Michael Cusnir. I'm Jackie Bello, Programs Manager for Debbie's Dream Foundation, and I will be moderating today's webinar. We'd like to thank our sponsors, Merck, Astellas, and Bristol Myers, for making our webinar series possible this year. First, I will share information about stomach cancer and Debbie's Dream Foundation. Then we will hear a presentation on coronavirus with Dr. Michael Cusnir. The presentation will be followed by a Q&A discussion. You can type your questions throughout the presentation into the chat section that appears on the webinar menu. We will address questions at the conclusion of the presentation as time allows. In addition, the recording of this webinar will be accessible on our website in the lecture library. Debbie's Dream Foundation cares about the general well-being of our community. With the unpredictable spread of coronavirus, we are doing our part to minimize exposure by participating in social distancing, as outlined in the CDC guidelines. As a result, we decided to cancel some of our upcoming events, and our staff is currently working remotely to comply with the latest recommendations. While we navigate these new challenges, we are still dedicated to the mission of serving those affected by stomach cancer. We will continue accepting patient inquiries and requests for mentorship through our PrEP program, and we'll offer free stomach cancer educational webinars and monthly stomach cancer support groups as featured in our upcoming events on our website. While in-person events such as our Dreammakers Gala and upcoming stomach cancer symposia are changing on a case-by-case basis, we will keep you informed of all postponements, cancellations, and rescheduled dates. And now, here are some facts about stomach cancer. In 2018, it was estimated that more than 26,000 Americans would be diagnosed with stomach cancer, and more than 11,000 would die. Most patients are diagnosed at stage 4, where the 5-year survival rate is only 5%, and the incidence rate in the younger population continues to increase. Yet, many know very little about this disease, and little research is being done. Pictured here is Debbie Bellman, the founder of Debbie's Dream Foundation. Debbie was diagnosed with stage 4 stomach cancer in April of 2008. She had no risk factors for stomach cancer, and her symptoms were very vague. At the time, she was told her chance of being alive in 5 years was only 4%. She endured harsh chemo regimens and targeted treatments and experienced many reoccurrences over 9.5 years. Unfortunately, Debbie passed away on December 23rd of 2017 at the age of 50. She dedicated herself to helping others with stomach cancer by raising awareness and providing resources and education. Debbie founded DDF in April of 2009. As an organization, we are a member of several advocacy coalitions. Debbie served for many years as a patient advocate on numerous committees and task forces. As an organization, DDF will continue her important work and legacy. Debbie's Dream Foundation is dedicated to advancing funding for stomach cancer research, raising awareness, and providing education and support internationally to patients, families, and caregivers. Our ultimate goal is to make the cure for stomach cancer a reality. You can learn more by visiting our website at debbiesdream.org. In a few short years, GDF has achieved many great milestones. We have 34 chapters across the U.S., Canada, and Germany. Our PrEP program helps patients, their families, and caregivers match with survivor and caregiver mentors using disease-specific criteria, including stage, biomarker, and location. We host educational webinars and symposia year-round, and our website contains in-depth information about stomach cancer and can be translated into more than 60 languages. We have also provided $1 million in research grants to date and advocate each year during our Stomach Cancer Capitol Hill Advocacy Day to add stomach cancer to the Department of Defense's peer-reviewed cancer research program. This past Advocacy Day was a huge success. We hosted 115 advocates, making this year our largest turnout yet, and our advocates had 230 meetings on the Hill. Due to the efforts of our foundation, our partners, and our dedicated advocates, we helped secure funding in the amount of $110 million, a $20 million increase from last year. Please consider joining us next year in February 2021 in Washington. This is a current snapshot of our website's homepage with links to numerous resources. CDS is headquartered in Plantation, Florida. Our office hours are Monday through Friday, 8:30 a.m. to 5 p.m. Eastern Time. Also, on this slide are important phone numbers and email addresses you can use to contact our office and staff. We will now begin the presentation on coronavirus, what the stomach cancer patient needs to know, with Dr. Michael Cusnir. Dr. Cusnir is an oncologist and medical director of Gastrointestinal Malignancies at Mount Sinai Comprehensive Cancer Center in Miami Beach, Florida. He holds board certifications in internal medicine, hematology, and oncology. Dr. Cusnir is also a scientific and medical advisory board member for Debbie's Dream Foundation and is active in the stomach cancer community, including local outreach, education, and advocacy. We'd like to thank Dr. Cusnir for taking time out of his schedule today. And now, Dr. Cusnir, we will turn the presentation over to you.
Thank you, Jackie. So if we can have the next slide, would be great. So I'm going to try to talk over the next, I would say, 20 minutes to 30 minutes at the most, to try to leave time for questions on a little bit of what we know of the current COVID-19 epidemic and what we are dealing on the cancer patient population. So the first thing is that the current guidance in regards to testing of patients with cancer, that it's been a question that I've been asked by many of my patients, that if they should be tested preemptive and to know if they are positive and how do they know if they are at a higher risk. It's something that is evolving, and we still don't have a local guidance of when to test the patients. The local and state directors of each of the different departments are kind of like changing this on a day-to-day basis. As we get more testing available in this country, we hope that we're going to have a little bit more widespread testing. Part of the problem here is that testing of completely asymptomatic patients may not be completely the best strategy, as the patients may have been exposed to the virus and in the incubation period, and that later on they might end up developing the symptoms and need to be retested. So that's part of the reason. If we can have the next one. The second question that it's kind of like coming quite a bit into our offices is if there is a vaccine. And unfortunately, as much as we know that there's research ongoing about a specific vaccine to prevent the coronavirus 2019 or the COVID-19, which is the way that it's been named the disease as well, there is no active vaccine that is being available to the public. And the best way to prevent the illness is to avoid being exposed to this virus. There is no other way at this time that we really have as a knowledge by the moment. Now, you have to be cognizant that the virus mostly, and the reason that I say mainly or mostly spreads from person to person is because there is a possibility of transmitting to surfaces in which if somebody touches a surface that a previous person that it had been infected touched on a short interval, there could be infection as well. And just recently, we learned that it appears to be that it's airborne. So that's the meaning that respiratory droplets that are left from a person that is infected or cough or sneezes might end up having a contamination, and that's the reason that you're seeing evolving that a lot of the different institutions are actually now increasing on the use of masks that it had not been used before. Overall, the concern is that these droplets can land in the mouth or noses or even into surfaces again that the person may end up touching, and that could end up increasing the risk of contamination. Next, please. Now, the virus has not been detected in drinking water, and most of the conventional, not to say all of the conventional water filtration systems in the municipal waters in all through the country are very effective. Like most of the places that we live on have chlorinated water in which the uh, tap water that we get is probably safe. And again, if the surfaces and the different drinking glasses that are being used are thoroughly washed and all that, the likelihood of obtaining positive contamination from a virus in drinking water is extremely low. So I don't believe that people need to be drinking bottled water or anything like that. On the other hand, the virus has been detected to be excreted in feces. So extreme hygiene is needed. There's actually a report just as of yesterday um, that the virus could be excreted even for a little bit of a longer period of time in feces of patients that are already completely asymptomatic, which is super important that if a person is being exposed or has been tested positive and it's in close proximity to one of our cancer patients, that they practice extreme hygiene in that situation since the virus could be spread in that way. On the other hand, similar to what I mentioned before of the municipal tap water, the pools and hot tubs tend to be chlorinated, so we don't have evidence that people that may be sharing as part of their relaxation or even in places that there may be pools that social distancing could be practiced and that you want to go and relax, that they could be contaminated. So in general, that appears to be safe. Um, Next, now, what to do overall in the setting at this time? And so what we're recommending our patients, and a lot of these recommendations are coming from the American Society of Clinical Oncology, that actually are coming from the Center for Disease Control. And you'll see that a lot of the information that I'll be talking here might be repetitive, but overall it's important because you'll see that cancer patients may do end up with a slight increase of risk of complications, even though that they're not the highest risk group in the whole society. To our surprise, it appears to be that patients with cardiovascular illness appear to be of a higher risk even than of the cancer patients, and even obesity by itself appears to pose a higher risk than what the cancer alone may pose. Now, what do we recommend anyway that all of our patients are doing? So the most important is to create a household plan of action. And then what we do is that we tell everybody that consider the members of the household that might be at a greater risk, such as the people that have chronic illness, elderly patients, and I mentioned elderly even not to be taken of 75 and over. We are actually keep decreasing that number. It appears to be that even 65 may be of an increased risk, and we need to make sure that they are as safe as they get. It is important, and mostly if you live alone, that you inform your neighbors and you kind of like also be aware of what their plans are. In a time of social isolation, it is super important that we keep the lines of communication open and that we care for each other. And if one of our neighbors knows that our patient may be alone at home, they could be just making a phone call a day and checking to make sure that they are with all their cares, um, with all their needs. I mean, supplied and all the different things that are important, and just to make sure that the person is safe. It is also important that you know how to access the information and healthcare services, as well as the support and resources that are available. Almost every single news media has opened their platforms so that everything that is COVID-19 related, it's openly available. So like the local newspapers, all the way to the local hospitals and healthcare systems are usually open and with phone lines that we are continuously informing our patients as the situation evolves. You do need to create anyway an emergency contact list in case that anything happens, that even that same neighbor that I mentioned before, that you could contact the different people and that it might help you to support in this situation, from anything that it could be, even grocery shopping, all the way to in case of need to be taken to an emergency room. Now, if you live in a household with multiple family members and you're undergoing cancer treatment, we do believe that it's important that a room is chosen in the house, that if somebody develops even very mild symptoms, that person gets isolated from the rest of the household. That might include even a single bit of sore throat or anything like that, in which the person gets isolated and gets minimal amount of contact from the rest of the family members. And once that is done, hopefully the situation might even be contained even within the same household, as much as the level of distance and the different plans of actions are taken into place. Next one, please. So, what happens if you are concerned that something is putting you at an increased risk in your own household? The first thing is to go in and put your plan in place. So, most important, you continue to put all your practices that we've been talking into action, in which you essentially try to continue to practice as safe actions as possible, and then separate the person that may have become sick at that time. Now, if you need to care for that person as a household member, you're going to need to follow much more strict recommendations, in which it includes to keep the surfaces disinfected, and any type of chlorinated solution works. Alcohol at more than 75% works. That being said, it's important for you to know that most alcoholic beverages are not good cleaning solutions. So I've heard of from a lot of my patients to know if vodka or things like that are good to clean surfaces. It's not, because vodka comes usually in a 40% concentration, and the concentrations that you need to use to clean this type of surfaces, if it is alcohol, needs to be over 75%. So rubbing alcohol, or alcohol cleaning solutions that are available in the marketplace are usually good enough. That also includes that we know now that some other substances like chlorhexidine that has been used in the past, or vinegar, are not the ideal solutions for cleaning, and I don't recommend them in average. You have to be very, very careful to avoid sharing any personal items, and that includes even utensils. So that if you're using utensil. Make sure that utensils are separated of the person that may be sick or may be at a high risk to need to be isolated, and any other personal items. If you become sick, please keep in touch with family members and neighbors so that everybody knows that they are keeping track of your situation, and that they will know that if anything of the situation is deteriorating, since it's a disease that appears to be evolving rapidly as the situation worsens, you need to be super careful to make sure that everybody knows how you're feeling at every given time. Um, Stay informed about local outbreaks, because the country, as you can tell, the numbers are evolving very differently in the different states. So you need to know. I actually, uh, not to be a pessimistic, but I actually do believe that if the epidemic continues to be on the way that it's going, the different places in the country will end up catching up to the ones that are more infected at this time, and we're going to see an outbreak in all the different areas that is going to range somewhere in between 40 to 70% of the population contaminated with this illness. But again, we don't know for certain. We just need to continue to monitor very carefully. And it is important also to keep your emotional health in check. So try to relax, try to do activities that keep you with your mind out of this disease on a continuous basis, and your mind also out of cancer all the time. So meditate, participate in some other type of leisure activities, and just try to read, relax, do some other physical activities that actually have been shown to be beneficial even against COVID-19, that people that remain physically active appear to be also doing better. Next, please. Now, definitely, again, there is no way to overemphasize to take particular care of the people that may be at a higher risk. You definitely need to be away from the people that may be older adults in your household, or with underlying healthcare conditions such as cancer. So those people need to be much more aware. Most of the places have activated even special hours in supermarkets for people to shop when they are of a higher risk. And the reason that it's still important that they practice social isolation, but maybe go into those hours to shop into the different places, is because the younger people appear to be asymptomatic transmitters of the virus, where you could be completely normal and end up passing the illness to somebody else. So if you go during the hours when it's only older patients shopping, the likelihood that somebody will be sick without having symptoms is less. But that being said, as a matter of remembering what I tell my patients, probably the biggest risk that I see to my population is their grandkids. I know that it's heartbreaking not to hug the grandkids at this time, but I think that you need to be practicing safe distance from kids. If they go to visit the grandparents, just social isolation from them. They could be in the room, but at a safe social distance, okay? Um, Everybody should be making sure that you have several weeks of medication and supplies available in case that you need to stay at home. We've seen what Europe has done. We don't know if it's going to happen in the United States, but we need to be ready. Most of the places in Europe are allowing people to go and refill medications, get supplies, but as the situation gets a little bit more dire, it's going to become more congested. So you probably want to start planning, and part of your household plan should be to have at least 1 to 2 months supply of medications. And we all, as physicians, have been refilling our patients' medications up to a 3 month supply so that everybody is safe and ready. And definitely, if you're in the public and you see somebody that is sick, stay away and limit close contact with everybody. Handshaking is off the books at this time, and you definitely need to practice good hygiene and water and soap. As I told you earlier, with the hand sanitizer, with alcohol and things like that. But better it's just to wash your hands with water and soap. 20 seconds of soapy water essentially break down the membrane that the virus has and inactivates it 100%. Next, please. So again, clean your hands often, avoid close contact, and if you are sick, be mindful of the other people around you and stay at home. I think that at this time, and we as healthcare providers are super, super concerned of contaminating somebody. And as we know that we could even be healthy transmitters, we are super mindful of even decreasing our contacts here in the office so that we don't spread the disease even further in medical practices. You've seen all over the news how to cover your coughs and sneezes, and then definitely to be right away uh, throwing away the tissue that you cover your face, or washing the surfaces where you may have sneezed. Face masks have been a point of controversy like you cannot imagine. And this is something that you can see that Anthony Fauci has not given a single press release wearing a face mask, but the situation is evolving. Just yesterday, I had a discussion here in my center of who should wear a face mask and who should not wear a face mask. And it is a situation that we don't know for certain. The current guideline of the Center for Disease Control is not to recommend a face mask unless that you are sick. Because if you're sick, you don't want to be spreading the virus as you cough and as you breathe. So it's mostly for protection of others. If the person that is sick cannot wear a face mask, we have to be wearing a face mask when we are in front of them. In my medical practice by itself, we have started to recommend most of our workers, that includes nurses and everybody, to wear a face mask because of the risk that we might be the ones passing the disease to somebody else, as much as that we could contaminate ourselves and bring the disease to our household, with some of us having family members that might be on the high risk categories. But the truth is that face masks require discipline. You have to be careful because I see people essentially wearing face masks almost in a reversible fashion, that they don't even know which one is the front and which one is the back. And when somebody has been coughing in front of them and then they wear the mask backwards, they contaminate themselves because this virus again could remain on the surfaces for a period of time, or that they touch the face mask to lift it up to drink a sip of water, and then they touch their face after they have moved the face mask in the area where it's the one that could be the most contaminated. So more than cleaning, disinfecting, and isolating, the face mask provides a little bit of a benefit, but not as much as people want to believe on the face masks. Next. Now, who should be tested? Again, not everybody should be tested, and again, the information is fluid. South Korea adopted a massive testing campaign that worked. I don't know if it's going to work forever, because probably as they open up the country again, we're going to see that they will need to deploy another campaign like that one, and it's going to be over and over until anyway most of the people will be contaminated, but on a much more uh, spread out curve than what we are seeing in some of the places like Italy, New York, and some of the other places. The second thing is that as most people have a mild illness and recover well, they could just avoid overcrowding hospitals and not need to be tested, except to isolate other people that may have needed because they could have been positive. But we are having a lot of trouble testing as of today in this country, that hopefully will be resolved. But as early as today, I heard that we are expecting in this country by the end of the next week to be able to test 1 million people per week. If we are crunching mathematical numbers, it will take 350 weeks to test the whole country. So again, somebody that has very mild illness and can recover at home may not be the specific person that we want to use that test at this time. And the second problem is that we still don't have any treatments that are approved for the virus. There's a lot of drugs that are investigational that we're looking with a lot of hope, but testing to say, oh, I will be treated earlier, it's not feasible yet. But again, testing would be helpful, but unfortunately, we don't have it yet. Next. Now, if you do feel that you need to be tested, every local healthcare department has been displaying their phone numbers. Here in Florida, the Department of Health sent us some posters to be displayed in the office with the number for the person to call, and that they will direct them to a drive-through testing or a testing facility. Some of the healthcare workers have been able to be tested in a specific facility. And the cancer patients, we are still following the same guideline of testing mostly if they have fever or symptoms of an infection as per the medical provider. So you need to know your local numbers. You can find them all over, and it's quite simple. The test still takes a good 48 hours in the best case scenario. We are going to be getting the rapid testing deployed all over the country probably by tomorrow, which should make the test available from the time that it goes into the machine in 45 minutes. But the truth is that we're expecting that the systems will be overwhelmed and that it still will take at least one day to be tested. So if you are tested, consider that you are sick, which will take us to the next slide, if we can move to the next one. That if you are sick, definitely stay at home, except to get medical care. Separate yourself from the rest of the house in the protocol that I talked to you earlier about home isolation. Call ahead your provider before visiting. We've had cases in our cancer center of people that may think that are positive and coming to our cancer center, violating some of the protocols. We have established guidelines in our office to screen patients outside of our center, and then to make sure that they're not contaminating our other patients and our healthcare providers, because you have to be mindful that as much as we want to provide care for everybody, that there's some other patients that are at risk and maybe even at a higher risk than yourself. So you need to let us know ahead of time that you're coming and that you may be sick, so that we establish proper protocols. And definitely at that time, you do want to wear a face mask. If you think that you are sick, you do want to wear the face mask so that you're not contaminating anyone else, and avoid sharing everything, and monitor your symptoms, including fever and any other symptoms, quite rapidly. Next. Now, when do you have to be aware of the emergency symptoms? So the most important is if you're having any difficulty breathing or shortness of breath. And that should be a reason to go to an emergency department. We are learning, as I mentioned earlier, that cardiac patients are at an increased risk. So any cardiac symptom, including chest pain or chest pressure, it's super important to go to an emergency room. Changes in the mental status, confusion, inability to wake up the patient, or if you see a bluish discoloration in the nails or lips or in the face, which means that the oxygen level is not as good as it should be. Now, this list is short of being called not all inclusive, because if you feel that there's anything that is not right, just come over. The healthcare system still has capacity in most of the places, and we need to be making sure that we care for everybody. And it doesn't matter if you have other illnesses like cancer, you still need to go to your emergency department or to your healthcare provider. Next. Now, what to do in most of the situations. So again, I moved back out of the emergency setting. 84% of the patients are going to be well and are going to be absolutely at home with no trouble from the illness, and they're going to be able to support themselves with not much of a problem. So the statistics as of now, and this is worldwide, is that 84 to 85%, to make the numbers round, are going to be absolutely able to stay at home. 10 to 15% of the patients are going to be very sick, and the mortality rate could be anywhere in between 1 to 3%, depending on the part of the world that we believe. But since most of the people are going to be able to be well, there's a lot that you can do to support yourself. The most important, try to even isolate yourself occasionally from the news. Okay, try to keep reading, watching, doing some of the other things. We as physicians are even getting pandemic fatigue, in which essentially it could be upsetting. We are talking to our colleagues around the country and to know what's going on, and even us need to be isolated. But if you are a patient, even more of a reason, and try to listen to your body, as we always say. Try to sleep well. Sleep is a good medicine. It decreases the inflammation of your body. Taking deep breaths, meditate, and try to eat healthy with well-balanced meals, exercise, get plenty of sleep, and definitely avoid things that could change your mental status, as I told you, that it's one of the warning signs. So we definitely want to make sure that people could make sure that you're well and that it's not compromised your health from any of the other substances that could come into play. Um, do activities that you enjoy. As much as I'm telling you that you should stay at home and isolate yourself, going into a walk a little bit outside of the house, kind of like to breathe fresh air, if you're healthy enough, and if you're isolating from other people as you may be sick, it's definitely important. And just keep connecting with others. Let people care for you as well, and make sure that they know about your feelings and your concerns. Next. Now, a trick question is, when do we discontinue the isolation? As you know, the disease, I told you that it could continue to spread a little bit for a few days, even if as you have no symptoms. That's the reason that we're recommending at least 72 hours of absolute no symptoms before you discontinue isolation. I have to be honest with you, I'm recommending my patients to discontinue isolation of staying home, but continue social isolation. There's been cases of reactivation of the virus, and there's been cases of people transmitting the disease a little bit later from this. Now, if you had an extremely mild symptom, just like a little bit of a sore throat, and you were not sure if you had it or not, wait at least 7 days since the symptoms appeared, to make sure that you're not contaminating anyone. Next. So we are seeing all over the country the systems go on lockdown. We have canceled all of our elective surgeries on executive order, which I do believe it's appropriate, because we need to save resources. We need to have our protective equipment ready for when it's going to be needed, and not be doing surgeries that could be done in 4 or 6 months from now. That being said, if one of our patients is undergoing uh, treatment with chemotherapy just before cancer surgery of the stomach, that cannot be delayed. And we're working very closely with our surgical colleagues and hospital administrators, that since we are on a timeline and this crisis may have taken some of us in the middle of treatments for patients that have curable cancers, we cannot actually postpone the curative treatments. So you need to talk to your healthcare professionals about the surgeries that may be needed. Antivirals should not be used. Again, leave that to us. And other routine medical care should continue as normal as possible, but cognizant that certain things need to be postponed. So, like for instance, if you have a routine colonoscopy, mammogram scheduled within the next month, I would assume that all of them are going to be postponed in the whole country and around the world. Now, I've been asked a lot about integrative measures, botanicals, um, herbal medications. They've not been validated in human trials, and I am not recommending them at this time. There is a concern that even some of those botanicals may enhance inflammatory responses and could make the disease worse in some of the patients. Next. Now, what happens with the immunosuppressive therapies like chemotherapy, radiation, and some of the different treatments that we are doing? That is a question to discuss with your healthcare provider. But this has been taken verbatim from the American Society of Clinical Oncology, in which we have been recommending that for patients that are in deep remission or maintenance therapies, stopping chemotherapy might be an option. If we can switch in some of the patients to oral chemotherapies and avoid them to come to the hospital, which at the end of the day is ground zero of this pandemic, it's definitely an option that we are looking. Then even spacing the chemotherapies a little bit more, it's something that we have discussed with our different patients, and withholding the treatment completely for a few weeks may not be harmful if it's not done with a complete curable intent, and even in some of the curable intent treatments. You have to be careful because local transmission at the cancer center could happen. So taking a break from chemotherapy might even be beneficial, or even we have been evaluating for the practices like ours that have satellite offices, that if we see an outbreak coming from one of our facilities, we're ready to deploy a different facility to continue with the treatments outside of the place where the outbreak may have occurred to decrease the transmission. But again, we cannot compromise long-term survival and disease control in all the cases, so it's going to be done on a case-by-case basis. The same goes for prophylactic growth factors that a lot of our patients are asking, as well as prophylactic antibiotics, which is something that we are evaluating on a case-by-case basis, but being way, way more open than what we were in the past. And with that, I think that will conclude what I had prepared of the presentation, and we can go to the next slide to entertain questions as time permits. Thank you.
Thank you, Dr. Cusnir. We did get a few questions. The first question, as a cancer patient, if I experience some early symptoms such as fever or cough, should I contact my medical oncologist or PCP?
Yes, your medical oncologist. So that actually, we actually have a protocol for that in the different institutions. Part of the reason is because as I expect that the emergency rooms are going to become more overwhelmed, and the cancer patients may have been on treatments that are suppressive to the immune system and to have what we call neutropenic fever, which means that their immune system is very low and they need to get antibiotics quite rapidly. Your cancer provider will be able to guide you if they have a protocol in place, like what we have, to be able to care for the patient faster than the emergency room will be able to do as they become overwhelmed to get the first dose of antibiotic and then refer to the emergency room. So definitely your medical oncologist is your first call.
Great, thank you. Next question. If I had chemotherapy in the past, does it raise my risk for getting COVID-19?
It depends how close is the chemotherapy. If the immune system still suppressed, it might. I cannot say for certain. But on the other hand, if it is a remote history of chemotherapy, meaning more than a month probably from the last chemotherapy, the likelihood that your immune system is going to be suppressed is low. So I would say low, but as a note of being careful, we know that cancer patients have a slightly higher risk of complications of COVID-19 than the general population. So still be careful.
Okay, great. Thank you. Next question. Are cancer patients at a higher risk for developing a severe reaction to coronavirus versus a mild reaction, such as cold-like symptoms?
Yes, so in the general population, the likelihood of very severe complications, if we are talking as the general population risk being 1, the cancer risk population of severe symptoms has been actually calculated at 7.8, and that's actually out of the data from a study that was released yesterday. It is not the highest of the general population. As I mentioned earlier, cardiac patients are at a risk that is close to 10, and diabetic, obese patients with cardiac history are the highest group at a risk of 13. Again, those are statistical numbers just to put it in perspective. So cancer patients are higher than the general population, but not the highest of the overall groups.
Okay, thank you. Next question. If my hospital has known cases of COVID-19, should I seek treatment elsewhere temporarily?
That's a very difficult question because I have to be honest with you that my feeling is that every single place now is likely to have cases of COVID-19. We have to be careful of what we consider that a hospital has cases of COVID-19 because as we don't have massive testing capacity, the possibility that there's cases that have not been able to be reported is extremely high. We are still awaiting tests in some of the patients here in Miami, which is a metropolitan area and in a major hospital that are more than 5 days old, of patients that I know that are very likely to be positive and that I don't have the result of the test, but I can tell you that there's likelihood that almost every single facility is going to have positive cases. If a facility has reports that it's an outbreak facility, and that's a different concept, meaning that from a single office many patients had been contaminated, it probably means that one of the healthcare providers, one of the radiation machines, you name it, might have been contaminated and contaminated some other patients, at which case it might be worthwhile to discuss with your provider if to go to a different facility, and that's the reason that some of us that have satellite offices are ready to deploy alternative facilities in case that we see an outbreak like that. But it's going to be important to discuss it with your provider. It's probably much more important to have some continuity of care than to be jumping from one place to another one, as we feel that this will end up evolving to the whole country.
Thank you. The next question. My mother is diagnosed with stomach cancer. She did chemo and had her stomach removed last year. During her recovery, she developed a bad infection and ended up in the ICU. A year later, she is still weak and we are working on her nutrition. Our family is very scared and we don't want her to get sick. What advice do you have for us?
No, the same one. Isolate her as much as possible and make sure that there's no contact with younger family members. If the caregivers are younger family members that are out and at work and that may bring contamination from the outside, those healthcare workers should be using isolation practices with extreme hand washing, using a face mask if you're getting very close by to the person, but not much more than the general recommendations, and definitely to try to stay at home as much as possible.
Okay, next question. Are patients who've had a total gastrectomy at a higher risk?
I don't know. I don't know, and we do know that patients that have total gastrectomy do have an increased risk of certain type of infections, but of this novel coronavirus, I don't know. The risk of certain other infections, such as influenza, does increase a little bit in patients that have total gastrectomy. So I could expect that there could be a slight but very low increased risk.
Okay, next question. I have a sister with stomach cancer. Unfortunately, the chemotherapy protocol is working perfect. And in 2 more weeks, she has a scan to see the evolution of her disease. The next few months, consider the evolution of COVID-19. What do you recommend?
It all depends on the intention of the treatment. If the treatment is for a cancer that is advanced and that it's not on a specific timeline, it might need to be considered to postpone or to give a chemotherapy holiday for a time being. We are really compromising what we usually do in oncology at this time. We've had a lot of our patients even go with an extra week in between treatments, which is less than ideal, but to allow for their immune systems to be much more up to speed and recovery in between treatments. But it's something that it needs to be actually discussed with the oncologist to see what the treatment intent. I can tell you that I have a lot of my gastric cancer patients that I have decreased the intensity of their chemotherapies onto a type of low toxicity maintenance setting while the crisis passes. But the problem is that we don't know when the crisis will pass. We expect a peak somewhere in between April to May, and then that it might start to decrease. And I say that with an absolute lack of knowledge and just based on epidemiological data of what we expect. But that being said, if we consider the next 6 weeks to be the more critical, we could kind of like try to take those weeks a little bit easier and then go back at full steam.
Great, thank you. Next question. Hand sanitizer is not available to us. What else can we use?
Water and soap. I don't get tired of telling this to my patients, and even if it's a matter of just having a little bit of one of those to take a piece of soap, and I've recommended that to some of my patients that also had some of the issues with hand sanitizer, to just take either pure alcohol, rubbing alcohol makes as well as hand sanitizer. It's just a little bit more fluid and messy. Hand sanitizer stays much easier in the hands. But just to take a piece of soap, break it into small pieces, and carry it with you outside, and just wash your hands as often as possible.
Great, thank you. Unfortunately, we're out of time for more questions. Dr. Cusnir, thank you again for joining us and sharing your expertise.
My pleasure. Anytime.
Thank you again to Mark Astellas and Bristol Myers for making our webinar series possible this year. Thank you for joining us today. To view our recorded webinars, please visit our lecture library. We would also love to hear your feedback, questions, and thoughts. So please be sure to take the brief survey that will be sent to you once the webinar concludes. This concludes today's presentation. Thank you so much for tuning in.